Hey everyone, I'm Taylor One Shot, and I actually wanted to make this video today because I'm officially 2 months out from my gender reconstructive surgery / gender reassignment surgery, SRS, or whatever you would like to call it. I had that 2 months ago in New York City at Mount Sinai with Dr. Jess Ting. The surgery went very, very well. I've been home now for about a month and a half. Things are going really great, and I wanted to make this video today to kind of talk about that, talk about my experience, the results, the aesthetics of it, the feel, just kind of everything in a free-formed type of fashion, and just kind of sit down and discuss my personal journey and my personal experience on this whole situation. It is a very intense and involving situation. It does take a lot out of you physically and mentally, and it takes a lot to get here physically and mentally. It is not an easy task whatsoever, and it takes a lot out on you. Especially it's really hard and difficult and challenging within this COVID pandemic era, as there was different things like it pushing back the surgery initially because I sought it out like a year and a half ago. But either way, you know what I mean? Even just then, like having one of the biggest things for me personally out of this whole thing is I've just been kind of sitting down, laying down for the past 2 months or so, just kind of healing and trying to get myself better. I'm able to get up a little bit and I get energy back each day. It was really, really hard for me to sit up in like your typical L fashion, kind of like I'm doing right now. I'm actually kind of impressed with myself. Most of the time I sit down with like this donut that I probably showed in my other videos before because it displaces the pressure and the weight. But I'm kind of getting to a point now which is pretty good. Not all the time and not for too long, but I'm finally getting to a point where I can kind of like sit upright and not kind of feel all that pressure. It helps that this bed is fluffy and light, so it doesn't have all that pain attached to it. As far as like the pain goes 2 months out, it's still there to some capacity. There's always some level of it. Like if things like contort and twist with your body, you kind of feel that on the new part and on this new like canal that you've created that is new, your new like femininity and womanhood parts and whatnot. So like the body takes its toll, especially as you get more energy back. You kind of like, sometimes at least for me, I feel like I can get up and do a little bit more, and then it kind of bites me in the butt later on because then I feel like, oh no, now I'm in pain, now I'm in soreness, and I need to calm down and I need to lay back down. Because there's like a limit of like testing your limit and testing your body and seeing like, are you ready yet? Are you strong enough yet? Can you get up and do the normal things that you want to do? And for the most part, I'm able to help myself with a lot of things. I did finally hit a milestone where I was able to like drive from my house to the coffee shop around the corner and get a coffee. It's only a block away from me. I was really nervous about that, but I put my donut down in the car and I sat down and I just took it easy and just went slow. I had nowhere to go and nowhere to be. So I just took it as an experience to push myself, because I've been trying to do that, as just kind of like push myself and feel myself out. I don't know if there was like a miscommunication with the doctors on my discharge or me, because I was going through a lot of pain and emotion and stuff and everything and all the stuff going on as I was being discharged from the hospital. So I really didn't have like too much of like a roadmap plan of when to expect to do certain things like going forward. Like I have ideas and personally feeling out when I'm physically capable of doing certain things. Like some of the things I want to be able to do were like go to the gym. I mean, when you're laying down for 2.5 months or so, like I put on some LBs because you're just laying down in bed rest, and it's hard. You know what I mean? I personally, it makes me feel a little dysphoric to put on some weight, and I really can't wait to like go back to the gym and get up and be able to do things again, especially with, like I said, this whole pandemic thing. It's kind of exacerbated that whole situation where basically like the whole world is finally opening back up now, and you're watching everybody go out and have fun like 2021 summer and do hot girl summer and all that stuff. And I finally at a place where I can like go out in bikinis and stuff like that and feel comfortable and confident. But like I can't do that because I physically can't like put myself through all of that. There was like a hardcore show that I wanted to go to that I had tickets for, that I ultimately decided the day of the show to not go because I didn't want to push myself too far, because I just wasn't sure that time 2.5-3 weeks ago when that show was, whether I'd be able to go out and do the long-term standing and like wanting to go out in the mosh pits and do my thing and just like, you know, have fun again. Like I'm so like, I have so much energy and I'm so eager to get back out into the world, but it's like I don't want to push myself and hurt myself and set myself back further down on the healing path. I mean, I've heard stuff from different girls and then just my own first-hand experience, because there's a lot of surgical pages. And basically from what I hear, and some of the stuff that I did get from Mount Sinai on the discharge and pre-discharge stuff, was like, I know like intimacy, you can expect to do that around 3 months, 4 months, you know what I mean? Though I hear a lot of girls personally say they waited until 6 months out. So there's a lot of different variations based on like your age, your weight, your background, your surgeon, the variation of the surgery that you had, because a lot of like cis normies don't really know that it's not just like one surgery. There's like a bunch of different types of vaginoplasty. You know what I mean? I personally went to Dr. Jess Ting, so I had the penile inversion with the PPT, the parenthal, I can't pronounce it, pull through technique that Ting kind of is the man and does his thing with. I've had really good results with that. Everything's healing very well. I'm happy with the overall look and aesthetic of it. There's still some swelling going on there, and it's kind of like gone down in some of the poofiness, and sometimes there's like this tightness, because I feel like everything's kind of healing and pulling itself down and readjusting and reallocating to where it's supposed to be now in its new form of my body and its womanhood and all that fun jazz. Some of that tightness has caused like a little bit of pain and stuff like that, especially if you're like feeling tight and then you're trying to like move your legs or walk around or get up or lay and roll around, because like you can't really lay on your sides and you can't lay on your stomach because that's just ouchy. You have to lay on your back, and I've been laying on my back for like 2 months, and I'm not always like a back lay downer. And I know these are small complaints, but like it's a complaint. And I have it, and I'm here to complain, and I'm here to talk about it, because there's some nights that are hard to sleep. You're kind of laying around all day, and you've burned through a lot of the media and things that are going to keep you excited and interested. Though I'm pretty passionate. I got a lot going on. I'm doing stuff. I'm looking into things. I'm working on projects. I'm always got something cooking in between everything, and some sad moments here and there, because things are tough sometimes. Emotionally, this is a lot. It's a lot to go through, both the healing and the mental side of it, because a lot of the surgery, I'm going to say, is like most people, 99% of people won't really know, outwardly speaking, that I had the surgery per se. They won't really know. Some people didn't know if I had it or didn't have it beforehand, or what the situation was. So I just want to say that this surgery is something that's very self-reflected and something that you do for yourself. If you want to do this, I'm not going to like necessarily encourage anybody or push anybody into doing the surgery, because there's so much that goes into it, and there's so much that you get out from it too. But if you're going into this thing thinking that it's going to make other people like accept you more, or change the way they see you as like a trans woman or anything like that, or change your level of social acceptance or anything like that, it doesn't do anything to fix any of that. As far as my personal experience yet, 2 months out, it's really just a self-comfort thing, a self-fulfillment thing. It's it makes you feel complete and whole, and it gets rid of a lot of anxiety. I feel so much happier. Not like I wear leggings. I wear leggings all the time now, and cute little shorts and stuff like that, and I can't wait to go out in swimsuits and stuff like that. And some girls are able to feel comfortable and confident going out and doing that with non-surgery or pre-surgery or any of that. But personally, I didn't. I did it, and I was able to brave the storm. But I always just felt so much anxiety going out there, and I was always so self-conscious in general. And I wouldn't wear leggings. I was jean queen, straight up, just wearing jeans all the time, because of the fabric on it would help conceal things. And I'd put purses in front of there and stuff, and I would stand in certain ways, and I would just avoid going to certain situations and doing certain things. Like at the gym, I wouldn't do squats or anything like that, because you didn't want anybody seeing anything. And there's a bunch of different stuff. I got an old video being trans at the gym. You can hear me complain about it back then. But overall, like, things are so great. Like, there's been times when I'm like dilating, which dilating is totally a chore. You got to do, I'm still doing it like 3 times a day, like 20, 30 minutes at a time. Sometimes I congest it into 2, once in the morning, once at night, and I do like a 30, 40 minute dilation session where I just like smoke beforehand, like weed or whatever. I don't know if I can say that, sorry. YouTube, I mean, it's legal in my state. Yeah, for pain, and the doctors honestly recommended it or whatever, for pain and for this whole process. And I do that, and then I just dilate, because dilation is a chore. It's like a medical tool. It kind of looks like a dildo or whatever, but it's this hard plastic medical apparatus that you have to put inside of you 2 to 3 times a day to keep the canal situated and to keep it going. And eventually you can do it less and less. I'm still doing that many times. Sometimes I jump up to the bigger size, and then I wake up the next day and then there's soreness, and I'm like, ooh, am I ready for it or not? You know, because there's different timetables on when your body's able to do these things. Certain of the material down there isn't necessarily as strong or elastic or malleable as like a cisgendered born woman. So sometimes things can be like tighter down there. And we're kind of still like building that part of our body or solidifying that part of our body in these early stages. So dilation sometimes it's a chore. But there's been some times where I've had like some pleasure type sensations and it felt really great. And I feel like reaching that O per se is possible, because I was worried about that for a while. I was like, oh no, I'm not going to be able to do this. I'm not going to be able to like relax and do that big O moment. But no, I think it's something that's possible once my body is comfortable and healed enough to do that. Because I've felt some different things. I'm not gonna get too much into it or talk about that stuff too much. But yeah, I feel it. I notice it. It's fun. It's cool. I can't wait to get there and experiencing that. But I'm in no rush. Because I just want to feel mentally and physically okay enough to do that and to bond with somebody again, and to bond with somebody for the first time in this way. But right now I kind of feel it as something that's like still a medical situation. It's still healing. It's still growing. Or not growing, but you know what I mean? I'm growing. It's healing. Yeah, I mean, that's like a lot of the stuff. Some things I've had is like, the surgical scars. You can, there's always like the surgical scarring on like the V line of the area there, like in between the legs and that area. And you can use like cream on there to maybe help with the scarring, because that does dissipate over time. I don't know if it ever fully goes away. I'm only 2 months out, so I'm not going to speak on it. And I'm sure some people, if you do it younger or whatever, might be super great. But we'll see what happens. But I used some cream down there. I did experience some light like bleeding, but I think it was because just like moving around too much. I did reach out to my doctor today about it and just waiting for an email back in return. And I just reached out to them to give me like more of a roadmap on different things. When I can go out to the gym, when I can go out to the gym more aggressively, when I can swim, what they suggest on intimacy, and just different roadmap type things on when I can do certain things, return back to work, and just a whole bunch of different things. I want to know their opinion, and I kind of updated them on everything that I felt and feel and I'm experiencing. So I can't wait to hear back from them and kind of build more of a roadmap going forward. That I'll probably update you guys on. Like I said, everybody's a little bit different, but at least if they can give me a generalized version of that, that would be super freaking great. And I would love that, and that would help me know what to go through or what to expect coming up. So I can't wait to hear back from them. I have like a generalized doctor's appointment for a primary doctor coming up in like a month or something. So I don't know if they're going to check that out. I don't know, first timer here, you know what I mean? But I'll figure it out, and I'll update everybody about it and talk about it here. I mainly wanted to make this video to kind of just like, as like a vlog type thing for myself, to just kind of talk out to the camera, talk out to the people, talk out to you guys, and just kind of put out any information that I can if you can gain anything from this. Or if you have any questions, sometimes it's better if like you ask questions and I can answer them, because on the fly sometimes in these one-shot takes, it's hard to like just keep everything going and keep everything focused on everything that I want to talk about. And sometimes I make these videos and I'm like, oh my god, I didn't talk about that one thing, and that was like the most important thing. But yeah, that's kind of my experience 2 months out. If I think of anything else, it's not like I need a specific reason to make a video. But yeah, this is 2 months out. I'm Taylor One Shot. You take care. You have a great day, and goodbye.